Hello, I'm Dr. Mary Massey Story, Assistant Professor of Family Medicine and Clinical Assistant Professor of Family and Community Medicine at Northeast Ohio Medical University's College of Medicine. Welcome to Take Charge of Your Health. These health videos are for educational purposes only. They're not to be used for treatment or diagnosis of any medical condition. Please consult with your primary care provider for treatment and diagnosis of any medical condition or health concerns. I'd like to talk about the importance of primary care. I'll talk about primary care practices, why primary care is important, who provides the services, and what those services are. Primary care can be provided by physicians, nurse practitioners, and physician's assistants. These providers deliver comprehensive and routine care for their patients. They can diagnose and treat acute and chronic conditions, and they provide information regarding disease prevention, health maintenance, health promotion, counseling, and patient education. Primary care practices are generally located near a patient's home. Their practice may include a team of physicians and non-physician health professionals. These practices provide patients with their own personal provider or provider group. The providers in these groups also collaborate with other health professionals to provide the best care for their patients. Evidence shows that access to primary care helps people to live longer and healthier lives. Primary care establishes effective communication with patients. It also encourages the role of the patient as a partner in their health care. Primary care promotes patient advocacy in the healthcare system. There are many benefits to having access to primary care. Patients often require less hospitalizations and emergency room visits. Primary care providers may catch problems earlier and help patients avoid surgeries. Children and adults who receive routine care have higher immunization rates. And patients who have access to their own primary care provider or group tend to be less frustrated with the healthcare system in general. We can perform well visits, physical exams, immunizations for the family are given. We treat acute illnesses and injuries, manage chronic conditions, and provide nutrition and weight loss planning. We can take care of asthma, arthritis, diabetes, hypertension, heart disease, women's health, and we perform sports physicals. We also help with mental and emotional health needs, tobacco management, and alcohol management. When we talk to patients in the office, we always obtain a history. This helps us to know what patients are dealing with and what we can look for as far as concerns that may actually exist in their families already. We'll ask about high blood pressure, heart disease, asthma, sleep apnea, history of stroke, diabetes. We'll ask about diet, if it's high in salt or saturated fats or cholesterol. That's important for us to know. If someone has had surgeries, hospitalizations, that's important to know too. If there's smoking and alcohol history, we'd like to know how long, how much, how often. We also ask about medications that are being taken, over-the-counter, herbal, or prescribed, because those medications can interfere with anything that we may also prescribe. We discuss concerns about weight, and we ask about concerns at home or at work. And we also talk about stress management and how people cope with the many stressors they have in their lives. And lastly, family history. Again, looking for other things that run in the family that may put you at risk. We perform routine physicals, and we may do also a very focused exam on some areas of concern. Based on information during the history in a physical exam, we may order lab tests or imaging studies. Lab work is drawn to look at certain parts of the body's systems, like the kidneys, the liver, the immune system, and blood. Medical providers can take these opportunities also to discuss health topics based on the patient's age, health history, exam, and test results. The United States has a Preventive Services Task Force. That's an independent volunteer panel of national experts in disease prevention and evidence-based medicine. They work to improve the health of all Americans by making recommendations about preventive services. So if you have a question about when you should have a mammogram done or when I should have a colonoscopy, pap smears, if you look at this website, this link, you can get more information and they can help guide you accordingly. You can discuss those recommendations with your provider. I hope this was helpful. Thank you for your time and take care.